This is the ABC7 Bay Area Spotlight, sponsored by March of Dimes in collaboration with Anthem Blue Cross Foundation.
If you're a mom, you probably remember what it's like when you took your newborn to its first well visit. Odds are your own health wasn't a priority, but that's changing. Organizations in the Bay Area are bringing special care to moms and their babies. Here in Alameda County, March of Dimes is using a new program to eliminate disparities in health care. The goal? Decrease rates of preterm birth and improve maternal health.
We're concerned about the growing inequities for women of color in birth outcomes and the unequal access to quality health care in our country. We feel that that's driving the preterm birth rate. So in Oakland, for example, the rate of preterm birth for Black moms is 75% higher, and for Latina moms, it's 30% higher than white women. With the generous support of the Anthem Blue Cross Foundation, we selected two grantees, Lifelong Medical Care and La Clinica de la Raza in Oakland, to adopt this new model of care into the way that they care for moms and babies. And the clinics are using a model called IMPLICIT, which is short for Interventions to Minimize Preterm Birth and Low Birth Weight Infants. And so what's unique about it is it's asking mom about her health at every visit she brings her baby in for their baby's care from age 0 to 24 months.
Can you take a deep breath for me? Good job.
We're asking about 4 health topics that we know are important in the first 2 years of life, and that's smoking, family planning, multivitamin and folic acid use, and depression.
At Lifelong Howard Daniel Health Center, they focus on family practice by caring for mom and baby together.
There's often things that we do provide and can provide for them, but having the grant and the time and energy is giving us space to really be able to pause and check in with the mom and say, well, how are you doing? And can we go over at least these 4 things that we think would really help you? A mom will have something on her mind, but doesn't think it's the time to ask and speak up for her own needs. And often when I check in with them, they go, oh yeah, I need birth control, or I'm having this issue and I do need to see my doctor. There's so much going on between the mom and the baby, and they're really one unit.
Here at La Clinica in East Oakland, pediatricians say this new type of care is making an impact in their community.
Sometimes you can do a really good job holding it together during your infant's visit, and then you're not telling the pediatrician that you're actually depressed, that you're anxious, that you're unable to see your doctor and follow up, and you're worried about your diabetes or your family planning. And through this screening program, before I even walk in the room, I know this mom's scoring really high for anxiety. I know that she's worried about where she's going to get contraception because she's not ready for her next kid yet, and I can address that. Being very attentive to your child leads to better health outcomes for everyone.
Dr. Horowitz believes there's a special relationship between a mom and a pediatrician. She says moms trust them with their baby's health, and maybe with that comes trusting them with their own.
People feel very close to their pediatrician. You see us many times during the infant's first year of life. Research has shown that women really like talking to their pediatrician, and my colleagues here have really loved doing the screening. They've had really wonderful, productive conversations with moms, and they've been very receptive to receiving resources from pediatricians.
These kinds of jobs take a community. You can't make a change with just one entity. At Anthem Blue Cross Foundation, we've realized that we can't do this alone. And so partnering with organizations such as March of Dimes is tremendous because we have a common goal and we're fighting that common goal together. At Anthem Blue Cross Foundation, we've recognized that healthcare is not just about medical. It's about behavioral, it's about emotional, it's about spiritual, it's over-encompassing. And so that's something that we're trying to make sure we include in our programs.
Programs that make a difference in the lives of moms and babies.